I did
No,
too
it's okay.
fast.
No, you're fine.
It says I'm live right there.
Okay, so you're good to go.
I guess I'm live now.
Yes.
Good evening, everybody. I hope there's a lot of people out there. My name's Andy Engh. I'm a physician here at the Anderson Clinic, and we're going to talk a little bit about our practice and how to schedule an appointment, and a little bit about our history. So we'll start out with me. That picture was probably 10 or 15 years ago, but nobody wants to see my picture nowadays. So I first started working at the clinic during summers, doing maintenance and yard work at the clinic, cutting grass, cleaning out the attic of the building, things like that. When I was in college, I knew I wanted to go into medicine, so I spent some time as a nursing aide at the hospital. That was the same hospital that my grandfather had started. You'll hear a little bit more about that in a bit. But then other summers, I also worked on my uncle's farm, cutting the grass, managing the fence lines, baling hay, and chasing cows. So in 1990, after medical school and my residency, I joined our family business. That's Anderson Clinic. About all I'll tell you about myself is that I specialize in hip and knee replacement. I've been married for 40 years. I've got two married children, one grandson. I went to high school here in Alexandria, then went to Davidson College just outside of Charlotte, North Carolina, University of Virginia for my medical school, and VCU for college. So pretty much a Virginia boy, except for those 4 years in North Carolina. So a bit about my family. Up in the left, you can see my grandfather, my grandmother, father, uncle, and my Aunt Sally there in the middle. So my paternal grandfather founded the clinic in 1941. At that time, he was one of the first orthopedic trained doctors in the metropolitan area. He was actually competing with general surgeons. In those days, often the general surgeons were the ones that were taking care of broken bones and such. And so this was relatively early in the history of the orthopedic surgery specialty. In the picture down below, you can see myself, my father in the middle, and my uncle there on the left by the X-ray box. My father was a great pioneer of hip replacements, and particularly hip replacements that attached to bone and became integrated with the bone and the metal. We didn't have to use cement, so we didn't have to worry about the cement breaking up over time because it was a live interactive interface between the metal and the bone. Currently, this type of technique or something similar to it is used in about 95% of the hip replacements in the United States. My uncle was also a pioneer, both in knee replacement and particularly in partial knee replacement was really one of his passions. So a little bit of the history. I got to look at my notes here a little bit, but Anderson Clinic, that's one of the early Anderson Clinic buildings. My grandfather purchased a piece of land on what was called Shirley Highway. It's now 395. And started a polio hospital. Polio at that time was a virus that caused paralysis. And before a gentleman named Dr. Jonas Salk came up with a vaccine in 1955. And after that, this little hospital that my grandfather started had iron lungs for breathing, and he would do surgeries to transfer muscles and tendons. One of the interesting things was it was a real community effort because as a tiny little individual small hospital specializing in polio, we depended, my grandfather depended on the families. So there would be families that would take the linen from the beds that the children were in, take it home, clean it, bring it in the next day. Families that would clean the rooms, And then, believe it or not, there were families that if the power went off, we didn't have a generator, they would come in and they would run the iron lungs to help some of these children that were paralyzed above the waist actually breathe. Well, as we all know, the polio pretty well got taken care of by the vaccine. And so by the time we get into the 60s, about the time I was born, 1959, we start to see a lot of growth in Arlington County and in and around Washington, D.C. There were plumbers unions, carpenters unions, and with all of this growth, there were a lot of orthopedic injuries, a fall, a break, and a sprain, back pain. And so this is when my grandfather made the transition from polio to an orthopedic specialty hospital. We needed a hospital that was specialized in orthopedic injuries, whether it was a knee injury, a shoulder injury, or a back injury. And so my grandfather donated some of the land. The county approved the permit for the hospital, and many of the union workers that he had cared for contributed the labor to build this orthopedic specialty hospital. And so that went on. And then by the time we get into the 60s and 70s, orthopedic surgery has become very specialized. Yes, you had general orthopedists in the 60s and 70s and 80s, but nowadays you have orthopedists that, yes, they were trained in all of orthopedics, but they specialize in hip or knee replacement or back surgery or sports medicine or hand. And I probably missed some. So that's sort of where we are, this era of orthopedic specialization. So a lot of patients will come and see me or one of the other doctors and say, oh, well, yeah, can you also take care of my back pain? Well, we can initiate and take care of your back pain by sending you to physical therapy and then hooking you up with one of our back specialists. And the same thing works when they come in with back pain and their hip or their knee hurts. Then they get them to myself or one of my partners. So I started in 1990. There were 12 physicians at that time. And at that time, we were pretty specialized. So there were joint replacement doctors. We had one spine doctor, where is he? Dr. Kahanovitz. We had a pediatric orthopedist, a hand doctor, and a foot and ankle doctor back then. Actually had two hand doctors, Dr. Butler and Dr. Lavallo. They both retired. So that was me in 1990. So, gee whiz, oh my goodness, look at this. Where are we now? I got to look at my notes. We got 8 offices. We started with one office. And that office, about 3 years ago, we transferred to this Shirlington office, which is actually where I'm sitting now. We had a Mount Vernon office. We subsequently opened an office in Lorton, then in Fairfax. And our newest offices are in Reston, National Harbor. We've got a surgical center. We've got some pain management at Virginia Hospital Center, and Silver Spring is our newest office. I want to point out and have a real call out to the National Harbor location because that's our surgical center. And if you had asked me 10 or 15 years ago, could I do a hip replacement, a knee replacement, a spine surgery, and go home on the day of surgery, come in, have your surgery, and be home or driving home in 4 hours, I would have said, no way, that's never going to happen. Now, they were doing that with sports medicine and arthroscopy and things like that, but never before would I have thought that I would be sending hip replacements and knee replacements home on the same day from a surgical center. It's just continues to amaze me. So now we're at 23 physicians, and again, we've got the specialties. We've added some. I'm looking at my notes here: joint replacement, sports medicine. Now, sports medicine, we have non-surgical sports medicine specialists and surgical. The non-surgical can do platelet-rich plasma, all kinds of concoctions. What's the other way? We call it regenerative medicine, and I'm missing the word. Dr. Hubbard's going to be upset at me Stem cells. That's what I was looking for. We do shoulder and elbow specialist, hand, foot doctors. We got two. We've got pain management. But this is just the physicians. I mean, we've got support staff, nurses, licensed practitioners, medical assistants, and then we've got a full admin team. And we couldn't do that without the full team. So that's our team now. Services, so we've also got X-ray and X-ray technicians. We can do ultrasound guided injections to joints, which can be very therapeutic for the patients. We have physical therapy at all of our locations except for one. And then we work together with other providers, interventional radiologists who can help us treat inflammation in the hip, in the knee, and the shoulder for patients that either don't want surgery or are not candidates for surgery. We have pain management. And then I mentioned our advanced orthopedic providers, particularly our physician's assistants. So now I'm going to move to, that's the history, a little bit about me. I'm going to move to how you get to Anderson. What do you do? You go to the website, search Anderson Orthopedic Clinic, and you'll see something like this. And at the top, you can look at the care team, the locations, the specialties, the doctors, and get a bio on each of the doctors. So you say you find a doctor or an area that hip, knee, shoulder, elbow, hand. You can do it the old-fashioned way. You can call us at our number. It's been the same number as long as I've been here, 892-6500. You can email us at scheduling@andersonclinic.com, and we'll get back to you. And we have some limited self-scheduling. Each of the doctors has a set number of spots that they can self-schedule. I probably see 2 to 4 patients that schedule themselves online into one of my slots. So lots of different options. We do have a call tree, and I apologize for that, but it works. We get quite a lot of calls. I tell patients if they know their doctor or with their provider, they can type in their name. That's one of the possibilities to get straight to the doctor's office. If you're not quite sure, you can go to our call center and we'll route you to the first available appointment. So you've called, you've made your appointment, you're getting ready to come in. The things that we need, we want your insurance card. Hopefully it's current. Need a photo ID. And this is a big one. A lot of, so I'm coming in for my shoulder or my hand or my ankle. You think that you're only being taken care of for that thing. We really need your medical history because we care for you, not just your orthopedic problems. So we need to know your allergies, your medications, your medical diagnoses. Have you had images before, an X-ray, a CAT scan, or a CT? Bring the disc or bring the report. If you've had surgeries before on the joint, bring your surgery report. All of this stuff is going to make it easier for your doctor to care for you. And then a big one for us and for you is your primary care doctor's name and address and phone number. Because in today's day and age, we can get that note right to that primary care doctor, if not the same day, in a couple of days. And patients really like to, and primary cares appreciate seeing, what's happening with their patients. So you've got all that, and maybe I'm out of sync here a little bit because the first thing, once you make the appointment, is you're going to get an email, and you're going to be setting up your patient portal. And so you'll get an email and you'll see the little button there, activate your account. And that's what you want to do, activate your account. Once you activate your account, you're going to see a window like you see over there on the left, Anderson Orthopedic Clinic. The thing to remember right there, your username is the email you gave us. and you don't yet have a password. And so you click forgot password and set your own password. Once you do that, you open up this new window and you enter into the Anderson Clinic Orthopedic Portal. And from there, you can click My Health, and you can add a lot of the information that I talked to you about, your contact information, your insurance, your pharmacy, your medications, devices that you have, your medical problem list. If you can do this beforehand, it'll make your registration process much more relaxing. And if you're sitting, waiting for a few minutes for the doctor, you won't be rushing to add all of this right there on your doctor's appointment. But don't worry if you can't. We can do it. We've got people. We can write it all down on paper. In fact, even one really good thing is if you type it out and you don't go through the portal, you can type it out. We'll scan it. We'll put it in your chart. So that's another option if you're just not so computer savvy. So you can go to appointments and see your appointments. You can see your past appointments. You can even work and set up a telehealth visit. I'm not sure how that works. It must probably goes through the doctor's office, but I understand that's happening. So lots of stuff on the patient portal. All right, now here's my pitch. One of the things on that first one down at the bottom, this was the same slide I showed you there, that initial sort of where does it hurt, Anderson Clinic. If you want to find out more, you can read about what others have said about Anderson Clinic. You can go to Instagram, Facebook, LinkedIn if you want. That's going to be patient reviews. One thing would be really sweet would be, if you come, you have your visit, you're happy with your visit, or if you're not happy or kind of happy, write us a review, leave a review. That's the way business is today. It'd be really great if you could write a review. We just love that. And we respond to those. We do check and we look at those reviews. Thank you. So that's it. There's me playing around in the office, zooming by. Thank you for being here. And let's see if we got any questions. So. Got my full team. Let's see. All right. Where did the Anderson Clinic name come from? Well, that's quite a story. My grandfather's parents came over from Scandinavia. We believe it was Norway. We don't know for sure. I haven't gone into that. And Anderson is a very common name. And the story is that there were so many Andersons on the boat, they had to name it, and they gave the name Anderson Engh, and Engh in that particular dialect is of the field because they were farmers before they came, and they ended up settling in Johnstown, Pennsylvania. So Anderson is the original family name from Europe. And all of the men in the family have been tagged with that as a middle name. So my grandfather was Otto Anderson Engh. It's one of those names you can spell frontwards and backwards, Otto. And then my father and my uncle, myself, my Uncle Jerry's boys all have the middle name Anderson. So that's the name Anderson. That's where that came from. All right, so we got another question. How has the clinic's approach to patient care evolved over the years? So patient care is, the things that haven't changed are listening to the patient, identifying their problem, finding out what their goals and expectations are, and just quite simply finding out why they made the appointment. What did they want to find out? the things that have changed are we have a lot more imaging techniques. We have MRIs, which were brand new when I started. We have CAT scans. We have images that can be done with dye. You can add a dye for spinal procedures to see whether there's blockages. We can now do a lot of procedures in small joints that we could not do before. So this is where our sports medicine doctors are very good at doing injections to treat pain. Our physical therapy has expanded, and so that can take care of a great number of patients' injuries. And then our surgery has gotten better. I mentioned a little bit about that earlier, about being able to have surgery and go home on the day of surgery. When I first started, after a hip or knee replacement, a patient would stay in for 6 or 7 days and then go home and would be on a walker or crutches for 6 weeks. Now they're on a cane in about a week. And so we've gotten efficient. We have been able to prove technologies with research. We do a good bit of research here to prove that every little change that we make is one that can improve our patients' lives. So that leads to another question about about our research institution and our education. So back in 1972, my grandfather and my grandfather retired at 74, made a contribution to their 2 sons to set up a research institute, because we wanted to be able to document the successes, the failures, and every aspect of surgeries that we perform. And so we had, we set this research up, and this was early on with these big old square IBM computers. And we started with like punch cards, and then we went to manual entry, and now we do electronic. And so we have taken that research that my father and my uncle started and kept on advancing to publish what we've learned. So the patient approach has evolved in part because of our research. We also feel it's very important to educate doctors. Many doctors will do a postgraduate fellowship, and so they will have finished their years of orthopedic training, and they will come to Anderson Clinic, in this case, to learn hip and knee replacement. But we also have doctors that are connected with Georgetown and GW, and some of their residents will come and rotate through and see some of the sports medicine techniques and other activities. We also have a program where right now we have high school students, and I just had a high school student on Monday came and shadowed me, a young woman who wants to go into medicine. And so she shadowed me, and then she's going to see work with a pain management doctor and then a sports doctor. She'll spend some time in physical therapy, and all this will go towards her senior project in high school. So we all of the doctors here believe that education is important for our community. And the other thing about education is education teaches us. We learn from what we teach, and we get challenged, and so it's good for us to be challenged and to stay current in academics. So let's. Any other questions? let's see, we got another patient. What sets Anderson Clinic apart from other practices was a question. Well, I think it goes back to that part where very early on, we were subspecialty orthopedics. So even by 1990, we were subspecialty. My father, my uncle, Dr. Glassman, Dr. Albrigo were doing hip replacements. We had Dr. Branch doing sports medicine. We had Dr. Butler and Dr. Lavallo doing hand, and that was new. In 1990, when I finished, maybe 4 or 5% of the doctors that I finished with would do a fellowship. Now it's about 95% of doctors do a fellowship. So that's one thing that sets us apart. Another thing that sets us apart is we've been here and in this community since 1941. So we're not going anywhere. We're part of the community that is metropolitan DC. As I said, extending south towards Lorton, out west towards Reston, and then now up into Silver Spring. And so we just want to serve a larger and larger area with the best excellence and the best providers that we have. And also the staff, because we can't do it without the staff. And that's the front desk. I mean, I walk in the morning on Monday morning, and I come in, and the first thing I get is hello from the staff. How are you, Dr. Engh? And the patients waiting in line turn around and they say, oh, that's fine. There's Dr. Engh going by. It's kind of nice. That's pretty much why Anderson and what sets us apart. We got more, Monica?
Yes.
All right. Thank you. Any case or moment that struck you? Oh, golly. Recently, I had a young man, 21 years of age, who had hip dysplasia. He was in college, but wanted to do his semester abroad in Australia, but he just knew he couldn't go to Australia without his hip fixed. And so several months ago, I fixed his hip, and this week I saw, so he was able to go abroad for his trip to Australia without any pain in his hip. He smiled and was happy. And I get that. And the other moments are just the hugs. We get hugs here at Anderson Clinic from our patients when they're happy. You know, some of them come in and they can hardly lift their arm up to give you a hug. And then they come in and they reach around and they can show you, they can put their arm around you and give you a hug and thank you. So those are the moments that are great for the doctors and the patients. Tips for keeping joints healthy. I think lifestyle is a big part of that. We all struggle a little bit with our weight, but that can have an impact. I also think, and I'm starting to learn this at 65, that my ligaments and tendons are not the same as they were when I was 25. And so a little bit of knowing when to take a little bit of step back, or maybe when not to climb up that ladder and clean out the gutters. That will keep you out of Anderson Clinic. All right. That's good. That's great. Well, I really appreciate the time. I hope you've gotten something from this. This is really about the clinic, our history, how to make an appointment, and our team. So have a wonderful evening, and thank you for listening.